Surgical ablation of atrial fibrillation during mitral-valve surgery. Background. A new patient undergoing mitral-valve surgery, 30 to 54%, present with atrial fibrillation, which is associated with reduced survival and increasing risk of stroke. Surgical ablation of atrial fibrillation has been widely adopted, but evidence regarding its safety and effectiveness is limited. Method. We roughly assign 260 patients with persisting or long-standing persisting atrial fibrillation who require mitral valve surgery to undergo any surgical ablation or no ablation during the mitral valve operation. Patients in the ablation group underwent further radiomyonisation to pulmonary vein insulation or atrial maze produced. All patients underwent closure of the left atrial appendices. The primary endpoint was freedom from atrial fibrillation at both 6 months and 12 months. The results. More patients in ablation group than in the control group were free from atrial fibrillation at both 6 and 12 months. There was no significant difference in the rate of freedom from atrial fibrillation between patients who underwent pulmonary vein insulation and those who underwent the atrial maze produced. 1 year mortality was 6.8% in the ablation group and 8% in the control group. Ablation was associated with more implantations of a permanent pacemaker that was not ablation. There were no significant between group difference in major cardiac or cerebrovascular adverse events, overall serious adverse events, or hospital readmissions. And the conclusions. The addition of atrial fibrillation ablation to mitral valve surgery significantly increased the rate of freedom from atrial fibrillation at 1 year among patients with persistent or long-standing persistent atrial fibrillation, but the risk of implantation of a permanent pacemaker was also increased. Thank you.